and sitting down with Dr. David Klein of the Stages of Life, and we are going to talk right now about tremor. What are we talking about?
Kind of an interesting problem. Okay, back in the day, they would call these things shaking palsy. Could be, well, it looks like Parkinson's. Not the sort of thing you can really diagnose without chopping somebody's head off and doing a post-mortem examination.
Whoops.
But tremor is a big deal. You have this resting shaking. What could this possibly be about? There are lots of disease states that can cause tremor. That shakiness, that resting shakiness that people experience, difficulty writing, difficulty looking in certain ways, difficulty driving, so on and so forth. Fine motor control. Tremor. Okay, what sort of medications will cause tremor? What sort of substances that we ingest, imbibe, or whatever that can cause tremor? Well, we have something called DTs. We all know that the history of DTs. This is where people go into withdrawal from alcohol, and it causes a gross resting tremor, hallucinations, and so on and so forth. Well, that's not what we're going to talk about here. I don't really care about DTs, okay? It's the sort of thing that if you have it, oh well, somebody else will treat it. What I'm really more interested in discussing, okay, are those life-threatening problems that are really more, let's say, avocational issues, things that make your life a little bit more miserable. How do you write, okay, if you're shaking? How do you work a mouse on your computer if your thumb is wiggling around? How do you drive your car if your eyes are shaking from side to side or your head is? Okay, these are frustrating issues that are rarely life-threatening. But individuals with Parkinson's know what it's like. They know what the fearfulness is for something that's progressive like that can cause much bigger problems down the line. And so there you are with that resting tremor. What are you worried about? You're worried about Parkinson's. Okay, there's a world of difference between a resting tremor, benign resting tremor, familial resting tremor, okay, medication-induced tremor, and sleep deprivation-induced tremor. Let's think about this for a second. How about let's figure out why you're shaking? Well, what do? How do you diagnose tremor? First thing you do is you stick your hand out. Put a piece of paper on the dorsum or the top of your hand, and then look at the piece of paper. That's the fastest way to detect a subclinical tremor. Is that piece of paper shaking? Very, very rapidly. Okay, that would be a resting tremor. Look at the palms of your hand. Look at your thumbs. Are your index and thumb rolling against each other? Something sometimes known as a pill rolling tremor. That's more characteristic of Parkinson's. Okay, are you having difficulty with knobs and dials and so on and so forth? These would be intentional tremors. Okay, very, very important. The differences and distinctions do make a difference in terms of treatment. So they are not distinctions without a difference. Entirely the opposite. It's terribly important to figure this out. So what do most people do? They go to the doctor. Okay, it's a good start. Okay, you don't want to be going necessarily to an acupuncture for this one. Okay, you're not necessarily going to go to a chiropractor for this one. So you go to your family doc. Good start. What do they do these days? They punt it to a neurologist. Now you're in for the star chamber of the year. Okay, they'll bounce you around, scan you, look you upside down and sideways, and go, well, I don't really know for sure, but it might be Parkinson's, and it might not be Parkinson's. You're going to get all the same questions, but none of them are answered. So the first thing you want to do is ask the questions yourself. Do your best to answer them yourself. How are you sleeping at night? Are you waking up in the middle of the night? Now, those are two very important questions. If you're not sleeping as well as you might, or if you're having to take sleep medications to sleep at all, what you may be looking at is something called hypoadrenalism. Your adrenal glands aren't working. Does that cause a tremor? Yeah. Yeah, it causes a tremor. Is it a treatable thing? Yeah. Is it inexpensive? Yeah. Is it easy to treat? Yeah. If you don't diagnose this, will it be treatable on its own? No. So how do we deal with this? Blood work is really the fastest way from here to there. Okay, you can do it by guesswork. You can try this and you can try that. You can take spaghetti, throw it against the wall, see if it sticks. That might work too. But really, blood work is going to tell you what is going on here. What is your cortisol level doing, for Christ's sake? Okay, it should be below 25, but it should be above 10. Okay, what's normal? 8 to 24. Okay, so the long and short of it is normal and healthy are just not the same thing. If your cortisol level is not high enough, you will not sleep. If you don't sleep, muscles go to hell in a handbasket, causing this type of tremor. It is the single easiest thing in the world to treat. Let's look at your habits. What else can cause a tremor? What might you be doing? Let's look in the mirror to see whether or not the problem is looking back at you. How much coffee do you drink? You don't think coffee will cause a tremor? Well, I can tell you from firsthand experience that enough caffeine will make anybody shake like a leaf. It will do this. It will do this to everybody. The heart will go flip-flop, but then you'll see these resting tremors. It's not a happy place to be. What other medications will cause tremor? Well, what about your Adderall? What about your Vyvanse? Your amphetamines will do it. It's kind of interesting how these things work. Okay, things that are adrenergic will cause tremor. What about those nasal sprays you're taking for allergies? What about the allergy medications themselves? They will cause tremor. What about your antihistamines? They will cause tremor. So look at what you're doing. When the doctor asks you, what medications are you taking? He's not limiting the discussion to the sorts of things that are given to you by the pharmacist. Okay, but vending machines count, as do the over-the-counter shelves count. Because many of the things that are on those over-the-counter shelves at one time were prescription items. Can they cause tremor? Can they cause resting tremor? And the answer is absolutely. It can mimic incurable illnesses like Parkinson's. That's the way these things go. So sleep deprivation, number one cause. Number two is probably medications that you're taking. Number three are foodstuffs containing caffeine and sugar. Will cause these sorts of issues. But what can you do? What should you do to start sorting out the issue? What can you do to treat yourself to see what the net effect is going to be? Well, you start with something called L-tyrosine. Okay, L-tyrosine will unplug many of the familial tremors. It will reduce the effect of medications and so forth that cause tremor, and it's cheap and easy. The worst thing it's going to do is make you feel a little bit better. It's L-tyrosine. That's L-tyrosine. Dosage there, you start with 750 milligrams 4 times a day. You may need to double it. Does it work? Yes. Is it expensive? No. Will you find out quickly? And the answer is absolutely. It may take you 3 or 4 days, and you're going to unplug dopamine as one of the possibilities. Bupropion, Wellbutrin, can sometimes cause tremor. Why? Because you're increasing dopamine levels. People don't ask about the antidepressants. Many doctors don't want to know. Many patients don't want to divulge the fact that they're receiving antidepressants. What about nicotine? You don't think that's an issue? Yeah, you're vaping. You don't think that's got plenty of nicotine in it? Yes, that will cause agitation, and yes, it will cause tremor. GABA, G-A-B-A, gamma-aminobutyric acids, over-the-counter. Marvelous medication for tremor. Why? Because if you have anxiety causing tremor or sleeplessness causing tremor, GABA will settle it down. I promise you this is not treating Parkinson's. This is treating one of the other sorts of issues. So what else will cause tremor? Weakness. Okay, you don't believe it? Hold your hand out by your side. Just stick it out at a 90-degree angle to your body. See how long you can hold it. It's going to start getting tired. The first thing that you'll see is tremor. So muscular fatigue causes tremor. So how do you treat that? Coenzyme Q10, certain proteins, alpha-lipoic acid, acetyl L-carnitine. There are treatments for these sorts of tremors, and the way you start with them is one at a time. Figure out which ones work, how much it's going to take, but it's done systematically. It's not that difficult. But the last thing you want to do is think you're going to end up like Michael J. Fox, rich but unable to smile. Not a good place to be.
Now, how about just nervousness and anxiety?
You think? Oh no, we never shake when we're nervous.
That makes you shake.
It will make you shake, absolutely. But that's an adrenergic effect. That's what happens. So how do you make yourself nervous? Lack of sleep, depression, medications, caffeine, not eating properly, eating a lot of sugar, which makes the blood sugar go up and then plummet. You can get a tremor from hypoglycemia. Now, hypoglycemia is not a good place to be. Hyperglycemia is not a good place to be. It's kind of interesting. Lots and lots of causes.
Well, tremors can really cause a lot of problems, like in driving.
Yep.
Or operating machinery.
Yes.
And they can come on suddenly.
Yes, all of the above. Hence the investment that we're doing right now in this discussion. So again, I spent a weekend with individuals that either had suspected, quote-unquote, Parkinson's or just had resting tremor. And it was great to be able to sit and watch people go through these cycles. With Parkinson's, it sits back and it doesn't really get much better or worse. So what did these people have? Intention tremors. What is it? More than likely it's cerebellar. Could it have been trauma? Yes. Okay, more than likely it's nutritional / adrenal issues. So this is kind of an interesting thing. It's not something you have to suffer with, but it is something you should have checked out.
All right, very good. Again, a reason to stop by Stages of Life and get a good workup every 2 or 3 months. And if you want to know more about stages of life, just simply get on your computer and go to suffernomore.com, suffernomore.com. And if you want to get into a program where you're getting the proper nutraceuticals and the supplements you need, sign up at stagesoflifevitamins.com. That's stagesoflifevitamins.com.